Ketoacidosis is a serious metabolic condition that occurs when the body produces excessively high levels of ketones, leading to an acidic environment in the blood. It is most commonly associated with diabetes, particularly type 1 diabetes, but can also occur in type 2 diabetes and in situations of prolonged fasting, alcoholism, or other metabolic disorders. This condition requires prompt medical attention, as untreated ketoacidosis can lead to severe complications, including organ failure, coma, or even death. Causes of ketoacidosis. The most frequent cause of ketoacidosis is diabetic ketoacidosis, DKA, which occurs when insulin levels are insufficient. Insulin is a hormone that allows glucose to enter cells for energy. When insulin is lacking, the body cannot use glucose efficiently, forcing it to break down fat for fuel. This process produces ketones as byproducts, which are acidic in nature. Excess ketones in the bloodstream lower the blood's pH, leading to metabolic acidosis. Other causes of ketoacidosis include alcoholic ketoacidosis, aka triggered by heavy alcohol consumption combined with poor nutrition, leading to a depletion of glucose and an increase in ketone production. Starvation ketoacidosis results from prolonged fasting or severe caloric restriction, where the body turns to fat stores for energy. Medication-induced ketoacidosis, certain drugs, such as SGLT2 inhibitors used in diabetes treatment, can increase the risk of ketoacidosis even with normal or slightly elevated blood sugar levels. Pathophysiology. In ketoacidosis, the imbalance of insulin and counter-regulatory hormones, like glucagon, cortisol, and adrenaline, drives the body into a catabolic state. Fat is broken down into free fatty acids, which are then converted by the liver into ketone bodies, acetoacetate, beta-hydroxybutyrate, and acetone. These ketones are acidic, and their accumulation results in a decrease in blood pH, leading to metabolic acidosis. Electrolyte imbalances are common in ketoacidosis. For instance, potassium levels may appear elevated in the blood despite overall body depletion, due to the shift of potassium out of cells in response to acidosis. Sodium, chloride, and phosphate imbalances also frequently occur, compounding the severity of the condition. Symptoms of ketoacidosis. The signs and symptoms of ketoacidosis can develop rapidly and may include frequent urination, polyuria, and excessive thirst, polydipsia as the body attempts to flush out excess glucose and ketones. Nausea, vomiting, and abdominal pain, resulting from metabolic disturbances and dehydration. Fatigue and weakness, due to impaired glucose utilization and dehydration. Fruity scented breath, caused by the presence of acetone, one of the ketone bodies. Rapid, deep breathing, small respirations. The body's attempt to compensate for acidosis by expelling more carbon dioxide. Confusion or altered mental state. In severe cases, ketoacidosis can affect brain function, leading to confusion, drowsiness, or even coma. Diagnosis. Ketoacidosis is diagnosed through a combination of clinical evaluation and laboratory testing. Key diagnostic tests include blood glucose measurement. High blood sugar levels often indicate diabetic ketoacidosis, though some cases, example SGLT2 inhibitor-related DKA, may present with normal glucose. Blood ketone levels. Elevated ketones confirm the presence of ketoacidosis. Arterial blood gas, ABG, analysis, shows metabolic acidosis, indicated by low blood pH and bicarbonate levels. Electrolyte panels, assess for imbalances in potassium, sodium, and chloride. Urinalysis, detects ketones in the urine, which supports the diagnosis. Treatment. Prompt treatment is essential to prevent life-threatening complications. The primary goals are to correct dehydration, restore electrolyte balance, and reduce blood ketone levels. Treatment typically involves fluid replacement, intravenous fluids, saline, to combat dehydration and improve circulation. Insulin therapy. Regular insulin administration helps the body utilize glucose and stop further ketone production. Electrolyte replacement. Potassium and other electrolytes must be monitored and replenished carefully. Treating underlying causes. Infection, illness, or medication adjustments may be necessary to prevent recurrence. Complications and prognosis. If left untreated, ketoacidosis can lead to severe complications, including cerebral edema, especially in children, shock, organ failure, and death. Early recognition and aggressive management typically result in a good prognosis, with most patients recovering fully. Patients with recurrent DKA may require long-term diabetes management and education to prevent future episodes. Prevention. Preventive measures include adhering to insulin or medication regimens, regular monitoring of blood glucose and ketone levels, avoiding excessive alcohol intake and prolonged fasting, educating patients on recognizing early signs of ketoacidosis for timely medical intervention. In conclusion, ketoacidosis is a serious, potentially life-threatening metabolic disorder primarily associated with diabetes. Rapid recognition, prompt treatment, and proper management are critical to prevent severe complications. Awareness and prevention strategies can significantly reduce the risk, ensuring better long-term outcomes for patients.